Welcome back to part 2 of our 7-figure cross-selling system series. And in the first video, I primarily targeted original Medicare, adding the Medicare supplement, drug plan, and any other ancillary plan. And I showed you a tool, a sheet that we personally utilize to help us achieve some really good results in serving our clients at the highest level, protecting them, and then also being blessed in return with a nice income for doing that. Today, I'm going to specifically target or focus on the Medicare Advantage side of things, because I know many of you are probably selling Medicare Advantage plans. And so I want to help you be able to cross-sell effectively with Medicare Advantage plans. Unfortunately, many agents just get the Medicare Advantage and never talk to the person they're sitting with, whether that's by phone or in person or on a Zoom or Google Meet. And unfortunately, it leaves them unprotected. And so I want to show you how to serve your clients at the highest level, protect your clients at the highest level, and then also be able to generate an income at the highest level as well. But just like in the first video, I want to recap some things that you need to be mindful of before we get in to the sales process side. Number one is, in the first video, I talked about making sure you get this mindset thing right. And more specifically, a lot of times agents don't cross-sell because they think they're doing something for their clients, to their clients instead of for their clients. And it's a little mindset shift, but it's very important when it comes to cross-selling. Because if you think you're doing something to them, then you're never going to cross-sell, you're never going to bring it up, and therefore leave your clients unprotected. So you need to adopt the mindset that I'm serving them, just like I said in the first video, and that I'm doing something for them. Here's the other thing. When I adopt a to them mindset, then I start coming up with all kinds of excuses on why my clients are not going to get these additional plans, whether it's a dental and vision plan, hospital indemnity, cancer, heart attack, and stroke, you name it. So it's very important that you get this mindset thing right. For sure. And then the other thing I want you to think about when it comes to mindset is you need to understand that many of the people that you're sitting down with came from a corporate America job or from some type of job where they're used to picking multiple plans during their open enrollment time of the year. So they're used to being, for lack of better words, pitched medical along with the prescription drug that normally comes together. But then they're also encouraged to look at critical illness, maybe a cancer plan, life insurance, and more. So if they've been used to doing that for years, or you could say indoctrinated into doing that or to doing that for years, then why would you break the tradition? Right? In other words, if they're used to picking out these different plans and they truly need these plans, then why, as you, their new advisor, why would you break the tradition and not fill in as many gaps as possible? So make sure you get the mindset thing right for sure. The second thing I didn't mention in the first video, but I'll mention it here, is you need to make sure that you're uncovering their needs and their pain points. And the only way you can do that is to ask really good questions, is to make sure that you're addressing those needs and those pain points, because ultimately, if you do, then they should not have a problem buying or enrolling in a specific plan to address their needs. Or if they don't need dental and vision, then don't sell them dental and vision. But they may need a cancer, heart attack, and stroke, or they may need something else. But the only way is to be systematic in your approach to asking questions, not just assuming things, but truly asking questions, finding out what their needs are, finding out what their true pain points are, and it's going to make your cross-selling journey a lot easier. And then number 3 is just simply to be clear. I like to say it this way: complexity is the enemy of cross-selling. You will never cross-sell at a high level if you're too complex. If you're all over the place, if you're TMIing them to death and telling them too much information and they just feel like they're drinking from a fire hydrant, then you'll never cross-sell at the highest level. So you do want to know your products. You do want to know that if they bring up certain pain points or needs, then you want to have products or plans in place to be able to address those. And you want to know about those plans so that way you can confidently convey that to them. Now, Here's the other thing. Some of you, and I hear this all the time, will say, well, I lack confidence. That's really why I don't cross-sell. And in a video that I made on this channel, I talked about confidence will have to catch up. So in order to get confidence, you have to be competent. But in order to get competence, you have to be consistently using this cross-selling system until you get the competence. And then ultimately, your confidence will catch up. So don't let that stop you. I'm not saying know everything, but at least have 3 to 4 bullet points of each plan that you plan to bring up that you can communicate. And that takes you being intentional in learning those plans in your spare time. So that way you can increase your cross-selling efficiency. All right. So now that I recap there and wanted to give you some new things mindset-wise and just a few bullet points before we jump into this, now we're going to look at what we call the Medicare Advantage side of things. So once again, I'm going to fast forward, just like I did in the first video, to you've already brought up the 2 main options of original Medicare and option number 2, Medicare Advantage, and they're choosing to go with Medicare Advantage. All right, so let's look at the Medicare Advantage side of things. And I'm using a platform called Sunfire. You may use something different, but in Sunfire, it allows me to put in all their medications, right? We want to check all their medications, their doctors. We want to make sure that we have the right pharmacy in. And I'm just going to pick a carrier just for the sake of this particular example. But one of the things that I want to do is I want to make sure from the very beginning, as I'm talking about my Medicare Advantage plan, that I'm priming the pump, so to speak, and I'm bringing up this GAP plan, this hospital indemnity plan that is going to help protect them even better. So I'm going to just use Sunfire to go down through and explain all the benefits. You can see it's all right here in plain English. And then if I fast forward or scroll down all the way to the bottom, it has the summary of benefits that I can download, and then it also has the evidence of coverage that I can go through. But I generally just use this screen here, and I go through and talk about the monthly premium, the deductible, the max out of pocket, the combined max out of pocket, the drug deductible, the catastrophic limit. And then as I'm going down through these services, and they're in alphabetical order, the first time you're going to hear me mention this GAP plan is Mr. and Mrs. Jones. Right here, it shows that the ambulance copay here is $295. But here's the good news. I have a little GAP plan or a hospital indemnity plan that I can add to this particular Part C plan or Medicare Advantage plan that can cover up to $200 of that, right? And I'm going to talk about that here in just a moment. Then I'm going to go through chiropractic, dental, diabetes. I'm just going to go all the way down through here. Then I'm going to get to emergency care. Your emergency care copay is going to be $115. But just like the ambulance copay, I'm going to talk to you about a little GAP plan that will pay up to $150 of that. So that's going to help protect you against that, especially if you're not admitted within 24 hours. Then I'm going to go through hearing services, home health care, outpatient services, outpatient mental health care, outpatient prescription drugs. And then I'm going to get down here to the outpatient surgery copay, right? And now it's going to say here, $325 or whatever that number is. I'm just using what they are here for North Mississippi, but it could be something totally different in your area. And then I'm going to say, Mr. and Ms. Jones, good news is I have a GAP plan that will cover all of that for you and help protect you against that. And I'll talk about that in just a second. So you see what I'm doing? Every time I'm coming up with one of these big copays right here, because these are the main copays I'm wanting to address. Big copays I'm wanting to address here. Every time I'm running into one of these, as I'm going through the Medicare Advantage plan benefits, I'm talking about I have a solution for them. Okay? Because there's a lot of people that tend to get really leery of paying these copays. And then I'm going to go down here and then I'm going to see inpatient. Look what the inpatient copay is, $388 per day. Mr. and Mrs. Jones, good news is I have this GAP plan that can help protect you against that. And I'll talk more about that in just a second. And then I also have, it also has a skilled nursing copay, and that copay after the first 20 days is $218 a day. Once again, Mr. and Ms. Jones, I know I sound like a broken record, but good news is we have a GAP plan that can shield and protect you against that. Once again, I'm looking to address these major copays. I'm filling in these gaps, if you will, of this particular plan. And so I need to be addressing that I have a solution for that as I'm going through the summary of benefits on this plan. And then, of course, I'm going to finish out with the prescription drug plan. So you don't have to be an expert. Let the tools do a lot of the heavy lifting for you. I mean, you can literally read all the information from the screen or open up your summary of benefits and do it from there. Okay. So now when it comes to this gap plan to address these copays, obviously, the plan premium in this case is zero. And I'm going to tell them that it's going to be a zero premium for this plan. But now I want to talk to you about this gap plan. Now, I'm using Heartland National's quoting platform. You may use Guaranteed Trust Life. You may use Aetna, Bankers, whoever. I'm just using this particular platform today for, just for the sake of ease. And Heartland is a really good plan to have and a very great carrier to work with. They pay their claims quickly and have great customer service. And so, we've been using them for a really long time. So I'm putting in all their information, and it leads me to this continue the quote screen. I'm an advocate and doing less days, right, and doing more money per day. Even though the skilled nursing here says they're responsible for the first 7 days in the hospital, I'm still going to only do about 4 days because the average stay across the country is about 4 to 5 days. So I would rather them get paid more, right? Because if you go back here, if we look here, it says here that it's $388 per day. So to have more than enough to cover them, I'm going to do $500 a day because if they file the claim themselves, the money will go to them and they can use that additional funds for anything else that may arise. More specifically, anything miscellaneous. Okay. So I'm usually doing 4 days for $500. You can do something different. I'm just showing you what I do. And then the emergency room, remember it was 115 if they don't get admitted within 24 hours. This particular plan is going to give me 150. And then if you remember, the outpatient surgery, I think, was 300 and something dollars. Now I'm going to put here 400. The skilled nursing, depending on what their budget is, the skilled nursing is 218 per day. So I may do something like, they only have $200 here. So it gives me up to $200 there. So as I'm talking about this, I'm going back and forth to the plan, reminding them of the big copays, and then I'm addressing it here on the quoting screen, right? So I'm going to get up to $200 per day for skilled nursing. And then the lump sum outpatient surgery is 400, and then the ambulance 200. So you can kind of see there, I've addressed all of these copays, 1, 2, 3, 4, 5. And then I could add a cancer benefit for it. Once again, it's just really going to depend on what your client's needs are. Let me stop here real quickly. It's just as easy to sell one app to a client as it is 4 or 5 apps per client. I know people think I'm stupid when I say that, but I'm telling you it's true. It doesn't take anything more, and while you have their know, like, and trust, and you're supposed to be the advisor that is guiding them correctly, go ahead and put everything on the application. So, I may do a $10,000 lump sum cancer benefit. Why is that important? Because they have to pay 20% of these cancer-related treatments up to the max out of pocket. Well, what's the max out of pocket on this particular plan? It's $9,250 for the year until this plan starts paying 100%. And how many of you know that people just don't deal with cancer in 1 year? A lot of times it's 2 to 3 years total. And so this max out of pocket is going to reset every year, and every year it's going to go up in most cases. So you need to make sure that you at least bring it up and add it to the plan, because you can always take away a lot easier than you can add something on. So it's better just to say, Mr. and Mrs. Jones, here is the full coverage. Here is the way to fill in all the gaps of your Medicare Advantage plan, your daily inpatient benefit, your emergency room, your outpatient, your skilled nursing, your ambulance, and then even an additional cancer benefit to help shield you against that 20%. And the total for that is going to be $103.60. Now, I have a sheet that you can utilize to help you do this, and this is a sheet, just like in the first video, I had a sheet to keep me on track, and I can go through here and use this sheet and fill in what the carrier's name is going to be, monthly premium, max out of pocket, effective date, Part A premium, Part B premium, give you some highlights, give you what most plans cover. And at the very bottom, what do you see there? You see the gap plan, the reimbursement plan information. And I can just start filling it in to match this right here. All right. And then I can put in what it would be with cancer. Remember, I said it's a lot easier to add everything and then take it away if you need to. So if I have to take it away, then I can write both premiums here, total premium with cancer, total premium without cancer. So don't be afraid to give them the full coverage. And then if it doesn't fit their budget, they will tell you. In worst case scenario, you get all the other copays taken care of, right? And once again, let's say they don't want the skilled nursing amount, then you can take that off and then it's going to bring it down even more. It's better to have everything on there and take some things away than it is trying to add things on. Okay. So make sure you're using this sheet or a sheet like this. Maybe you make your own, and to help you stay on track and to make sure that you're writing everything you're writing. I like to have everything written down. All the notes that we take during a conversation is on this form, and I actually give it to them in a little folder that I give them. Okay, so this is one thing that we want to make sure that we're utilizing to help us stay on track, help us to get away from chasing a lot of rabbits, to be more efficient when we're dealing with Medicare Advantage clients. And then worst case scenario, they don't get a gap plan at all. And so once I write everything down, I just slide everything over to them and then I'm quiet, right? Then once again, we don't want a TMI in this moment. We want to write everything down. We've done our job and now we're presenting it to them and we're going to let them decide if this is going to be a good fit for them or not. But let's say, they say, do I have to get it now? I am pretty healthy, whatever the case may be. You can say you don't have to get this plan, but we strongly suggest it because this particular company gives you a guaranteed issued time frame of 64 and a half to 65 and a half, and you are going to be 65. And so even though you're healthy now, Mr. and Mrs. Jones, it's better to go ahead and put this in place because down the road, if you unfortunately get some medical conditions, they could keep you from qualifying for this down the road, which means now those big gaps could come back to haunt you. Right. So that's something that we could come back with. Or if they say, that's not in my budget, right? I can't afford, and I didn't say this earlier, but I generally try to do the $10,000 lump sum cancer benefit. Once again, you could do more, you could do less. I'm just telling you what I do. But let's say I give them the full coverage here and they just go, well, you know what? I just don't know if I can afford $103.60 per month. I'll say, no problem at all. Mr. and Miss Jones, we can always take away one of these or two of these benefits to make it fit in your budget. As it stands right now, Mr. and Mrs. Jones, what monthly amount do you think fits in your budget? I may say something like that, right? Or out of all these different benefits, we definitely want to keep the inpatient one because that's the biggest one. We definitely want to keep the outpatient one. The emergency room comes automatically, so we can't take that away. And then I definitely would keep the ambulance one. But out of all of these benefits right here, which one do you think you're the least concerned about? Well, a lot of times they may say, I don't think I'm ever going to have any issues with skilled nursing. Okay, well, we can take skilled nursing away. Or no one in my family's ever had cancer. They may give you something, to that effect. And you could give them a stat what how high the percentages are of people that get diagnosed with cancer over the age of 50. So there are different rebuttals that you can come up with. The bottom line is you just want to be ready that if they do give you an objection, that you do have something that you can give back and provide, a substantiated, a substantiated way to overcome their objection. Apologize, I can't talk today. All right. And here's the thing. I think I said this in the first video. We're not in the timeshare business, right? We're not trying to arm lock someone into buying a HIP plan. We are just simply uncovering their needs and pain points, and we're offering solutions. And I'm going to do my best to make sure that they understand the need for it. And I'm going to be able to overcome some objections. But at the end of the day, I'm not locking doors here and forcing people to get a plan. I just want to make sure that they understand why it's so serious to consider it. And if I've done my job throughout the whole presentation of highlighting the need to be protected against these copays and highlighting the max out of pocket, then generally your attachment rate should be very high if you're bringing it up. If you're not, then obviously, you're not going to make any additional sales at all. But think about it this way, this is going to help maximize what I call your ROR, your return on relationship. Meaning I'm building this relationship. They're trusting me. I'm on the phone with them. I'm in person with them. And I want to do everything I can to maximize that because that not only helps me protect them, but it helps me bring more money into my business, which helps me help more people like the people that I'm sitting across from. It helps me be more efficient by hiring the assistant that I need, putting more money into marketing, helping me cover the overhead so I can be a long-lasting agent/agency, right? So there's a lot of reasons that you want to be able to add this cross-selling. Now, there's going to be some people that you may not be able to get a hospital indemnity plan because of health conditions. And that's okay. Maybe they're on disability Medicare and have all of these situations, or maybe they just have tons of health conditions and they're outside of that guaranteed issued window. Whatever the case may be, you could do something more like a cancer, heart attack, and stroke policy. I won't get into that in this video, but there are other things that you can add if you can't get a full-blown hospital indemnity plan. Well, now it's up to you. You got to take this information that you've learned in this video and you need to go implement it. If you need one-on-one coaching, you're more than welcome to look down in the video description. My email address is there. Reach out to me and I'd be more than happy to coach you more one-on-one. Also, if you want to get access to these forms, you can either make your own version of it or you could look at partnering with us because all of our partners get free access to all of our forms and all of our other training. All right, God bless you guys. And listen, if you're wanting to learn how to generate leads on social media, more specifically on TikTok, then go watch this video here.